Well, since this is starting to become Female Health Week around here, I wanted to highlight this article that just came up in my research about fibromyalgia. And yes, fibromyalgia isn't only for women or people who identify as women, but it is much more common in them. And this is a great article about how THC can help. I'm Lex Pelger. I do canna education for CV Sciences, the makers of Plus CBD. Ask me anything. This article was originally in German, and while my German is rusty, my Google Translate skills are great. And so in this study, they followed 161 people with fibromyalgia, and they also did a literature review before they started, and they found two randomized clinical trials as well as two observational trials where cannabinoids were helpful for people and had a low rate of side effects. This study focused on people who had tried other therapies and nothing was helping, with people who had severe impairments of their life or their employment, and people had tried a range of drugs which hadn't helped the situation enough. These patients used capsules of dronabinol, which is simply THC that is made in a laboratory and is usually given in 2.5 milligrams or 5 milligrams at a time. And because the Germans are so progressive, this was reimbursed by their healthcare system. The patients usually started with 1.25 milligrams or 2.5 milligrams of THC per day, and then slowly worked their way upwards to see where their sweet spot would be, which is perfect. It's what we always tell everybody. It's why we have these great gummies that you can cut up so you can get exactly the amount that you want, except that ours is sourced from full spectrum hemp, which I think is just a little bit better than THC all by itself. The researchers capped the max dose it would give people at 33 milligrams of THC, which is a reasonable limit. People would generally just go upwards until their pain was enough under control, or until the side effects got too intolerable, which really usually just means that they were having too much of a psychoactive effect. People don't like being that high. Luckily, it does seem like something happens where the body in pain tends to eat some of the psychoactive effect. People in a lot of pain, or sometimes with more serious mental health things going on, the psychoactivity doesn't get to them as much. Not only do they build up a tolerance to the psychoactive effects of THC, also it seems like the body uses more of the THC and less of it goes to the brain. That might not be pharmacologically what's happening, but it's something you hear about from a number of patients. In the patients getting the THC, they saw significant pain reductions. And they also saw smaller levels of depression, though it didn't reach the level of statistical significance. But more importantly, most of those pain patients saw their use of other analgesic painkillers decrease. In words you don't often see in scientific papers, these researchers said that a previous group, Habib and Artul, had described the changes by cannabinoid therapy as dramatic, and that this group found that they also agreed that they saw dramatic results in their patients. The average dose of THC ended up being around 14 milligrams per day, and the lowest dose used was 4.4 milligrams per day. One intriguing finding was, unlike many painkillers where tolerance starts to develop, they found that the longer they increased their observation window, the more effective the THC was becoming. It seemed like it was changing the patient's threshold of pain itself. The side effects are the ones that you typically see around people taking THC, including drowsiness, dizziness, dry mouth, palpitations, and increased appetite or feelings of restlessness. And most of all, these patients reported an improved quality of life. And really, that's what you're always looking for at the end of the day. So I thought this study was very helpful. It was one that can be very applicable. And if you want to see more studies like this, check out CVResearch.info. And under the pain page is where I have more studies about fibromyalgia and the cannabinoids.